Chronic obstructive pulmonary disease is a deadly progressive disease of the lungs. Lung function deteriorates over time, up to the point where the simplest day-to-day activities cause wheezing and shortness of breath. COPD is one of the leading causes of death worldwide. More than 3 million people die from COPD every year, with more than 90% of these deaths occurring in low and middle-income countries. The prevalence of COPD lies between 9 and 15% in most regions of the world, but can go as low as 5% to as high as 25% locally. The main causes of COPD are smoking, air pollution, cured meat, and a diet low in antioxidants. Let's see how you can prevent COPD or how you can stop its progression. Remember to subscribe to our channel. Decreasing lung function. The most common parameter used to characterize the severity of COPD is called forced expiratory volume in 1 second, in short FEV1. It describes how much volume of air can be forcefully exhaled within the first second of a breath. It can be compared to the predicted volume based on healthy lungs and the given age, height, weight, and other confounding factors. Very severe cases of COPD are characterized by such FEV1 ratios lower than 30%. COPD is also characterized by a lower than normal ratio of FEV1 to the greatest total volume of air breathed out in one breath. It is not the lung volume that matters, but how severely the airflow is obstructed during breathing. COPD and smoking. Smoking is the most serious risk factor for COPD. It is estimated that more than 80% of COPD cases are caused by smoking. Lifelong smokers have a 50% probability of developing COPD in their lifetime. This long-term risk drops by about half when they stop smoking. And for those that are already affected by the disease, the rate of COPD progression is slowed down when they stop smoking. But it is not only first-hand smoking. Second-hand smoking, when cigarette fumes are inhaled by innocent bystanders, is also a significant risk factor. Third-hand smoke, so chemical residue of cigarettes found on clothes, surfaces, even in the air, is probably harmful as well. So stop smoking for your own sake and for everyone else's sake as well. Dangerous nitrites. One way smoking causes lung damage is via the inhalation of nitric oxide, which is converted into nitrite in the lungs. Nitrite damages collagen and elastin, the elastic connective tissue of the lung lining, and can even cause elastin to break apart. Our lungs are able to repair a lot of the damage caused by smoking. For example, the lung cancer risk of those that stop smoking drops significantly within a few years. Sadly, COPD is a progressive disease and lung function generally does not improve. Nitrites from cigarette smoke should be avoided as much as possible, but cigarette smoke is not the only source of nitrites. Cured meats are the main dietary source of nitrites and have also been shown to cause lung damage. Dangers of cured meat. Each 50-gram serving of processed meat a day is linked to a 56% higher risk for developing COPD. The population group eating the most processed meat has a 3 times higher risk for developing severe COPD and also a 76% higher risk for developing asthma. Cured meat significantly increases the readmission rate of COPD patients to the hospital and is also a risk factor for lung cancer. And don't be scammed by labels on processed meat packages such as uncured or no nitrites added. They can still contain nitrites added through other means. Processed meats are also often high in saturated fat and sodium, which can also negatively affect lung function. Antioxidant layer. The surface of our lungs is exposed to various pollutants, not only from cigarette smoke, but also from car fumes, volatile chemicals, or wood or gas burning fireplaces. Thus, our lungs are protected by a thin layer of antioxidants that protect the lung tissue against oxidative stress caused by these pollutants. The stronger this antioxidant layer, the less tissue damage occurs over time. Studies have shown that the antioxidants you consume via fruits and vegetables can be detected in your lungs' antioxidative defense. And if your fruit and vegetable intake is low and you have COPD, your lung function can quickly deteriorate and the risk for sudden exacerbation increases. Fruits and vegetables. How low of a fruit and vegetable intake will cause COPD symptoms to deteriorate? Just the level of fruit and vegetable intake typical on Western dietary patterns. Just 100 grams of fruit per day can lower COPD mortality risk by 24%. Next to fruits and vegetables, green tea, soy products, and fiber-rich foods, especially whole grains, have been shown to protect against COPD. Sadly, on Western dietary patterns, the intake of these healthy plant foods is very low. Some extra beneficial plant foods for COPD are nitrate-rich vegetables, such as beetroot, arugula, and other green leafy vegetables. These nitrate-rich vegetables are known to improve oxygen transport in the blood. Our lungs can also suffer from systemic inflammation. Inflammatory processes in the lungs can cause productive coughing and impaired gas exchange, meaning impaired uptake of oxygen and exhalation of carbon dioxide. Systemic inflammation has many risk factors, including a poor diet, obesity, a sedentary lifestyle, environmental toxins, infections, and many more. Eating a healthy diet and leading an overall healthy and active lifestyle can significantly improve systemic inflammation and thus COPD symptoms. Actionable steps. Let's look at some actionable steps you can take to prevent COPD or to stop its progression. Stop smoking. Avoid processed meat. Eat lots of fruits and vegetables, the more the better. Watch your saturated fat and sodium intake. Eat more soy products and whole grains. Try to reach a healthy weight in a healthy manner. Avoid other sources of air pollution if possible. Thanks for watching. If you liked this video, please give it a like and subscribe and activate the notification bell. See you next week!